Countries across Europe are beginning to lift their lockdowns this week, and many are using face masks to stop a second wave of coronavirus. Well, joining me now is consultant ophthalmologist Dr. Alistair Lockwood. And Dr. Lockwood, you think we should already be routinely wearing masks?
I think it's important to look at the evidence, and one of the things that we know is that we've done a study where you can show that you can reduce the risk of contamination by that happens even just when you're talking in an area. And we know, I mean, the World Health Organization said you should wear a mask if you have a cough or you have a fever. But we know also recently that up to 50% of people who have COVID-19 may be infected yet have no symptoms. And so it really is just logical, really, to wear face masks or anything that will restrict the movement or passage of saliva in certain situations. So in areas where there are enclosed public spaces, such as supermarkets or in public transport.
And what's the science behind this? How do you know how effective face coverings are?
Well, this is actually based on a study we did back when we were looking at the use of face masks in surgical operations. We showed using coloured saliva when you're just talking normally through an operation, that the surgical site can be contaminated in 60% of operations if you're not wearing a face mask. And you can cut that down to 0% by wearing a face mask.
And so far, the government guidance hasn't encouraged us to wear face masks. So has that been bad advice?
I'm saying that basically we know that the saliva that COVID-19 is transmitted in saliva droplets, and we know that social distancing is fine in open spaces, but just like the Americans would say or have advised, in enclosed spaces where social distancing can sometimes be difficult, particularly when you're talking to other people, does it make sense just to restrict that flow that could happen?
So how much of a mask should we be wearing then? Should it be a surgical mask, or can it be something like this, which is something that I use for skiing?
Absolutely. Anything that is going to restrict the droplet flow through when you're talking, or if you're at risk of sneezing or coughing or otherwise, then you're doing much better than you are if you're not wearing a face mask. I mean, sure, if you really have the access to the surgical face mask, or you have a very well-fitting mask, that's going to be slightly better. But wearing just a scarf is an awful lot better in terms of when you're talking and with saliva transmission than nothing at all.
And how much of the face should it cover? Should it be just the nose and the mouth? And how far around the face should it go?
Yeah, I mean, that's a very good question. If you can cover both the nose and the mouth, then that's fine. There will be certain people who will find that difficult, and there will also be people who have pre-existing problems with their breathing or respiratory problems. So I'm not suggesting that people who, say, for example, have bad asthma or problems with COPD, chronic obstructive pulmonary disease, to wear face masks for these reasons. You don't want to wear a face mask that's going to cause detriment to your health. But if you are able to wear a face mask effectively, then yeah, whatever you can do.
So why then do you think the government didn't tell us to wear face masks? Surely this could have saved lives.
This is a very new situation, and it's unfolding all the time, and we don't have a huge amount of evidence for this particular virus. The other thing said is that basically we're thinking also, or there is the possibility that there's concerns that there may be a relaxing of social distancing measures if people were to wear face masks, and to presume that actually it's okay then to go much closer than they would do normally. And I think that it's really important that we as a population, we don't do that, we don't let that happen, and that we are responsible. But I think as evidence comes out, I hope that the guidance will reflect that evidence.
Well, Dr. Alistair Lockwood, thank you very much for your time today.